Are you a woman who experiences vaginal pressure, a vaginal bulge, difficulty emptying the bladder or the bowel, where you have to lean forward or lean back to empty your bladder to pee, or you have to lean forward or back to have a bowel movement, or you have to push up in the vagina or push back a bulge to have a bowel movement, or you have low back pain? All of these things could mean you have prolapse. And when a woman has prolapse, then she determines, okay, who should I see? Should I see a gynecologist, a urologist, or a urogynecologist? And that's the question we're going to answer today. This is Dr. Tugbiyele. Dr. Foley here, board-certified urogynecologist. And a gynecologist is someone who has gone through training, typically 4 years of OB/GYN training. That's obstetrics and gynecology. Residency after graduating medical school, and then finishes a residency where they learn both obstetrics, delivering babies, and gynecology, taking care of non-pregnant women in the office or in the operating room. And this is someone who can take care of women, who does annual visits, who takes care of women in terms of their health maintenance, and performs various procedures, whether it's in the office or in the operating room. However, a gynecologist typically doesn't have, and their training doesn't involve urogynecologic procedures, for example, to take care of prolapse and incontinence that a lot of women require. And so I have a lot of colleagues who are gynecologists that refer patients to me. They're great, wonderful, well-skilled, and they take care of women who who have lots of different conditions. However, when it comes to taking care of prolapse and incontinence, that the gynecologist skill set typically is not to the same degree as someone who has graduated from a fellowship trained program and is a board certified urogynecologist, so to speak. And then a urologist is a specialist who takes care of both men and women. And a lot of urologists take care of more men than women. And they've gone through residency training. They have been trained to take care of conditions of the kidneys, the ureter, and the bladder. And some urologists also may take care of pelvic floor conditions. However, most urologists take care of men, and those that take care of women may not be to the same, again, degree as a urogynecologist. And I have a lot of well-trained, skilled urologists who refer patients to me to take care of for their patients, their female patients who have prolapse and incontinence. And so that brings me to a urogynecologist. So a urogynecologist is a specialist who has, like myself, I went through initially obstetrics and gynecology training, 4 years of residency. And then after that, I then went on to complete a 3-year subspecialty fellowship in urogynecology, where I learned to take care of women who have conditions of the pelvic floor and the pelvic floor is the muscles, connective tissue, organs, blood vessels, and nerves that make up the woman's pelvic floor, that provide support and normal function to the pelvic floor for a woman. And so after completing that 7 years of training, then I became board certified in taking care of women who have these conditions. So definitely, board certified fellowship trained urogynecologists, we have the most expertise and skill and experience to take care of prolapse and bladder leakage in women. And so that hopefully that answers that question. While a gynecologist does take care of women and does a myriad of ways of taking care of women, and a urologist takes care of more men than women, a urogynecologist kind of blends the both worlds together, where we take care of women, and also not just the gynecologic aspects of a women's pelvic floor healthcare, but also the urologic. And so as a board certified urogynecologist myself for 20 years and top doctor of urogynecology in Atlanta, I've cared for thousands of women with prolapse and bladder leakage successfully, safely. And I tell my patients that they don't have to live or put up with these conditions. They're very common. They affect a woman's quality of life, the ability to enjoy the things activities, be comfortable. A lot of women may feel like they're not attractive, or that they can't do the things they enjoy because of prolapse, and they impact quality of life quite significantly. But what I like to encourage my patients is that they're good, again, safe and effective solutions and treatment options that are available nowadays, that as urogynecologists, we have the training, the expertise, the experience to really counsel women about these options and decide with her what would work best to restore her quality of life and confidence. So if you are looking for a urogynecologist that you can trust, who has the expertise, the knowledge, the experience, then one of the ways to reach me is to visit my website. That's www.drtugbiyele.com. That's www.drtugbiyele.com. And there's an inquiry form that you can fill out that will take you to, that will be handled by my team. That's one way to reach me. My office number is 470-325-1280. And that's another way to reach me to set up a consultation. And I'd love to be able to work with you and you with me in order to help to improve your pelvic floor health and quality of life. And that's it. I'll see you in the next video. Take care.